This is to provide a brief tutorial on the use of the plan of care form that's used by Georgia Hope. This form essentially represents the signature page of a contract between Georgia Hope and a client and or the client's guardian. And the contents of the contract that this represents are what's contained in the client's individual recovery plan. So basically, when a client signs this form and we sign this form with them, the client is indicating that they're in agreement with the individual recovery plan contract that has been developed. And we are in agreement with providing the services and the interventions and addressing the goals and objectives that we have helped the client to develop. So the plan of care is an extremely important form and needs to be filled out fully and correctly. So some of the elements of the plan of care form obviously are fairly self-explanatory, but I will explain anyway, simply to make sure that the elements of this form are clear. So the plan of care form obviously needs to include here the client's full name, and needs to include the client's date of birth. And so that this is so that when this form is scanned to the client's electronic record, that it's scanned to the appropriate chart. The date of assessment that's included on this form. So the plan of care may be used at an initial intake. It may be used when a reassessment is completed, but it also may be used at some other time when the individual recovery plan needs to be updated for some reason. So the date that's entered here needs to correspond with whatever the activity is, whether it's an assessment or for some reason the individual recovery plan is being updated. So that's what goes in that date of assessment box. Here in the services section of this form, you're going to check off whatever services are going to be included in the client's treatment. Now, this doesn't necessarily guarantee that these services will get authorized, but anything that has been included in the client's individual recovery plan and has been ordered in the client's care record should be checked off and included on this plan of care form. This is the commitment of Georgia Hope to pursue these services for the client, and this also indicates that the client agrees to the provision of these services as part of their individual recovery plan. This center section of the form is probably the most important part of the form, and it's also the most unfortunately overlooked part of the form, I think, sometimes. The summary of goals in the treatment plan or individual recovery plan needs to include the type of information that you see a sample of here. So the summary of goals needs to include basically the goals that will be addressed in the client's individual recovery plan during their treatment with Georgia Hope. So the information that's provided here needs to really meet the same criteria that a goal in the individual recovery plan would need to meet. It needs to be measurable, it needs to be specific, it needs to represent needs that the client has identified, and it needs to be goals that are agreed on between the client and the clinician. So basically, if you simply write out the goals that will be included in the individual recovery plan in this section of the plan of care, then you're covered. Um, what's not acceptable in this section are one-word answers or just a list of symptoms. So, for example, you don't want to say here anger, depression, anxiety. Those are problems. Those are not goals. You also don't want to just include a list of services in this section of the form. Services are addressed up here. So this section of the form, as nearly as possible, needs to represent the actual goals that will be addressed in the individual recovery plan. And you can see from this example how specific the information that I've included here is. So I can't emphasize this enough. Please make sure that as nearly as possible, this section of the plan of care represents the goals that will be included in the individual recovery plan. This bottom section of the plan of care indicates any tasks that the client may need to complete either during the course of treatment or before treatment. It basically is the client here indicates the types of tasks they're in agreement with completing as part of their treatment. And this will vary depending on the needs of the client. Some clients, for instance, may have a DFACS case plan and others may not. Some clients who have a substance use diagnosis may need to indicate that they will attend 12-step meetings or participate in random drug screens. But this section of the plan of care is where the client indicates tasks that they agree to completing as part of their treatment with Georgia Hope. Now notice this box at the bottom of the plan of care form and the statement that's contained in here. I've developed and reviewed my treatment plan, including goals, objectives, interventions, and transition plan with a Georgia Hope staff member, and I feel this currently meets my stated needs. I will contact a staff member to make any changes in my treatment plan if my circumstances or goals need changed. So when the client and or their guardian, as well as the staff member, sign this plan of care form, they are agreeing to that statement. And so it's very important that this statement, as accurately as possible, represent a summary of the treatment that the client is agreeing to participate in as they enter services with Georgia Hope or continue services with Georgia Hope. So it's extremely important that this form be accurate. At the bottom of this form, you'll see places for signatures. In the case of child and adolescent clients, both the client and the parent need to sign this form. The staff member obviously needs to complete this form, provide their information and credential, and need to sign this form as well. The form needs to be dated. The date needs to correspond with the creation of an individual recovery plan. It doesn't necessarily have to have the same date, but we should be able to identify what plan of care goes with what individual recovery plan. When this plan of care is completed, it needs to be scanned to the client's ECR, and that can be accomplished either by scanning this paper document yourself and emailing it to scans@gahope.org, or that can be accomplished by placing the paper form in one of the scans folders at either the Dalton or Woodstock offices of Georgia Hope, so that it can be scanned at a later time and correctly added to the client's electronic care record. The last thing to keep in mind is that a copy of this form needs to be left with the client. So it's not enough just to have explained this form to them and have them sign it. They need to have a copy of this form in their hands when the form is completed. And that's why we provide this paper or this form on paper rather than electronically, and that's also why you should have available to you copies of this form with a carbon copy background as part of the form. So that's the tutorial for the plan of care form. Please contact me, dbaker@gahope.org, if you have any questions about this form or any of the instructions included in this tutorial are unclear. Thanks for your time.